Hi, everybody. This is Brooke Lierman. We're going to get started in about 1 minute. Thanks so much for joining us tonight. If you are not speaking, I just ask that you keep your mute on so that we can make sure we hear everybody. And just because it's easier for folks to see the panelists as they speak, I'll ask that you keep your video off as well, unless you're one of the panelists. But thanks so much for joining us on this beautiful spring evening. It's great to have you here to talk about a really important and serious topic, but we're really grateful that you're here, and we look forward to starting in about 1 minute. So thanks for joining. Still see some people hopping on, so we're going to give folks another minute or so. Thank you so much for joining us tonight, and we're about to begin. Okay, well, I think we have everyone. So good evening. Usually I'm saying good afternoon because usually I hold these in the afternoon, but it's great to be with you all this evening. I hope you're doing well. Maybe you're sitting at your dinner table and you have your laptop open, or you just finished dinner, or if we're between you and dinner, then we promise to be brief and make good use of your time. So my name is Brooke Lierman. I'm a state delegate from District 46, and I'm honored to serve with my state senator, Bill Ferguson, and two co-delegates, Delegate Luke Clippinger and Delegate Robin Lewis. And we love serving District 46 and working hard here at the local level, but also passing legislation that affects the entire state. So today tonight, I'm really happy that we are talking about a topic that we should spend more time talking about, frankly, and that is treating gun violence as a public health threat that it is. But before we begin, I want to make a few points about where we are today and why I host these webinars. And I actually had one on Tuesday, and I have a couple next week as well. I think that being an elected official is about more than just passing legislation. It's about connecting people with the resources that they need, driving discussions about important topics, and advocating for change in multiple ways, including making sure that we all have the information that we need to be good advocates. I think government is about reducing barriers to success, creating opportunities for all, and of course, keeping our residents safe. And as we find ourselves in the midst of this great pandemic, this public health crisis, there's no better time for us to make sure that we're educating one another on the other threats that we as a society face so that we can emerge stronger from this. So where are we today in Maryland? Well, today we find ourselves with 43,531 confirmed cases in Maryland. We've lost over 2,000 Marylanders, and we have nearly 1,400 in hospitals today. A less reported statistic is that during the past 3 months that we've been tallying these COVID-19 numbers, there have been 65 homicides in Baltimore City as well. And as we should be, our city, our state, and our country are engaged in a full-scale public health response to COVID-19. We should absolutely be doing that, and what we are. Our governor and all elected officials are listening to the public health experts. We're implementing public health policy in a way that I've never seen before. And we're gonna spend billions of dollars in Maryland to save lives, right? We are engaged in rigorous social distancing. We've put our economy in jeopardy on purpose, because we need to treat this public health threat so seriously. But as this takes place, I think we also have to focus our efforts on recognizing that gun violence is continuing to plague our state and is also a public health threat. And we have to treat it like the public health crisis that it truly is. The epidemic of gun violence started well before COVID-19 arrived. And if we leave it untreated, it will continue after we reopen our economy, so that our economy can never be as strong as it truly could if we eliminated this public health threat as well. So reviewing evidence from practices in Maryland, all around the country, it's so clear that treating the spread of violence like the spread of disease, it's sensible, it's more effective, it's less costly, and it works than trying to jail our way to safety. I'm so thrilled tonight to have a number of people with me who are real experts on this topic, who are experts on from the ground level, from the research level, from all different perspectives, national perspectives, state perspectives, city perspectives, on gun violence and what we can do to make our city and our society and our state safer. I will note that Maryland has a program, the Maryland Violence Intervention and Prevention Program, Maryland VIP or Maryland VIP, that we in the General Assembly created in 2018 in partnership with many of the people on this call tonight. It was a bill that I carried and was proud to lead on and work to pass as a bipartisan effort. We funded that bill once. Unfortunately, it has been unfunded for the past couple years, and we passed a bill this year with Senator Jill Carter and the folks on this call as well to require the governor to fund that program. But unfortunately, the governor vetoed that bill this year. So this program, the Maryland VIP program, has the sole purpose of funding community level programs that engage in gun violence prevention using public health tactics. Unfortunately, we're simply not investing what we should in those kinds of strategies to see the effects that we need. But tonight we have wonderful experts here, and so I don't want to take up too long with my introduction, and I'm thrilled that you're all here. Thank you so much for joining me. Tonight we're going to start with James Timpson. JT is the Director of Youth Work and Crisis Intervention for ROCA Baltimore. In his last role as Liaison Officer for Safe Streets Baltimore, he was responsible for providing oversight, technical assistance to the directors of 5 community Safe Streets sites. JT is the former site director for Safe Streets Park Heights in Baltimore. I'm so pleased to have him here. If you have questions throughout this, you're welcome to write them in the chat box. Our panelists are welcome to respond to them in the chat. And then after the panelists speak, we'll also have time for Q&A as well. JT, we're going to start with you, then we're going to turn it over to Mike McLively from Giffords, then to Daniel Webster from Johns Hopkins, to Greg Jackson, and then we're going to end with Karen and a few final parting words, and then we'll have our Q&A. So look forward to hearing from you all. And JT, I'm going to turn it over to you. Let's see. Unmute yourself. You're good.
Yes. Thank you.
Go for it. Yeah.
All right. I don't know how to work the slides. Did the slides make it into the presentation or not? If not, it's okay.
We didn't get them, sorry.
Okay, all right. Well, yeah.
If you want to share your screen, I can stop sharing mine.
No, it's okay. I'll just go with it. I don't want to take up.
Okay. Okay.
I'm not that technologically savvy, so.
I understand. We're all learning. We're all learning. Yeah.
Thank you, everyone, for the opportunity. Thank you, Delegate Lierman, for the opportunity to share a little bit about the work, about what we've been doing at ROCA, and about the wonderful support that we've received from the MD VIP group, as well as yourself, Senator Carter, and a few other local politicians throughout the state, specifically in Baltimore. So just a little bit about ROCA really quick, so we can just get an understanding of kind of who we are and who we serve and where we're kind of coming from. So ROCA is a program that services young men 16 to 24 years old in Baltimore City. We service young men who are at a high risk of either being victims or perpetrators of gun violence. So we serve young men who are really deep in, on the deep side of everything. The way that we do that is, well, let me talk a little bit about our framework. Our framework really is 3 components. First, we start with the brain science, because there is science behind all the work that we do. Very evidence-based, very data-driven approach to violence interruption or violence intervention for us. The brain science, really, we took a look at the brain and understood that the young men that we serve are in a unique situation. They're highly traumatized, and because of the trauma that they've suffered, it has caused them to literally, for lack of better words, be out of their mind at times. And the way we look at that is the brainstem, just really simple. The brainstem causes your blood to pump. You wake up in the morning, you don't have to really think about it. The middle part of your brain, the limbic system, is where a lot of the decisions come from. Our young men are stuck in that limbic system. That's the fight, flight, or freeze. That's where that's stored. And most of our young men are so highly traumatized that they view everything around them as a threat. So they don't feel safe. They don't trust. And so everything is a threat. What we try to do is get them through that limbic system to the prefrontal cortex where the executive functions happen. That's where people are allowed to make decisions. What happens is the traumatized brain, unlike the healthy brain, it shuts off in that limbic system when there's so much trauma there that those neural pathways stop working, stop functioning, they aren't built. Kind of like a road that's shut down, right? You see the road construction going on, that road is closed. What we try to do is through our cognitive behavioral theory, the CBT, we try to help young men really stay alive long enough to make better decisions. CBT is a set of 7 skills that is designed to really help young men learn how to emotionally regulate. And all the work that we do, the street work, education work, workforce development, workforce readiness, is all based in CBT. Those 7 skills are really the 7 skills that really help change young men's lives. We're a 4-year model. So in that 4 years, what we hope to do is be able to, 1, help young men reduce recidivism, and then 2, we want them at the end of it to be able to sustain long-term employment. Now understand again that we're dealing with young men who are so deep in criminal activity, are so deep in the streets, that this program will not be effective 6 months, 12 months. It is a long-term solution to a long-term problem. These young men have been traumatized their whole lives. So what has happened over 16 to 24 years is not going to be undone in 12 months. It's not going to be undone in 24 months. A lot of situations won't be undone in the 4 years that we're with them. But again, our goal is to really help them to reduce their criminal activity and be able to sustain employment. One of the slides that I really wish was up was the one that shows the statistics, the data. And I can pull it up on my phone and recite it to you guys. I'm sorry that it's not up in front of me.
That's great. And if you send us the slides, we'll be sure to share all of them when we email everybody with the video too.
Okay, yeah. So one thing I forgot to mention about the framework. I'm sorry, I started with the brain and then I kind of skipped. But we start with the brain, and then there's the CBT. What we want young men to understand is what they think, feel, and do are all separate, but they all affect each other, right? So we try to help them work through what we call cycles, because again, if they think something is a threat, it's going to affect how they feel, and how they feel is going to affect what they do. And so we really try to disrupt that cycle of irrational thinking, that cycle of viewing everything as a threat, that cycle of not feeling safe by using those 7 skills. Also, the last part of the framework is the stages of change. We understand that young men, a lot of the young men that we get, or all of the young men that we get, are in what we call pre-contemplation. And what I love most about the model is that relapse is actually built into our model. We expect young men to fail. Failure is not such a negative term. It's an opportunity for learning. It's an opportunity for teaching them through the failure how not to make those mistakes again and how to do something different. Young men are in pre-contemplation when we get them, and we're hoping to take them through those stages: contemplation, planning, action, and sustaining, to be able to move them through life, right? And we use different situations that they're going through each and every day is how we implement CBT and really help work them through the situations and issues and problems that they're going through.
Right.
MD-VIP. Here's the thing with MD-VIP. What MD-VIP does for us, or the lack of the funding, how the lack of the funding hurts us, is that we're in the middle of a pandemic right now. For some of these young men, we are the only people that they trust. As the outreach workers, as the guys who know them intimately, as the guys who go through all these situations with them to help them through these situations, as guys who have been through a lot of the things that they've been through, they don't trust government. They're not watching Dr. Fauci. They're not listening to the Attorney General. They're not seeing that stuff on TV. So the only education that they get about COVID is the education that we provide. So without intervention workers or street workers out there doing the interruption work, the violence interruption work, how does the message reach those who and otherwise don't watch mainstream and are outside? They don't have time to connect.
Yeah.
So we really want to be able to continue the work on 2 fronts. The violence work is ultimately what's most important.
Yeah, yeah, but spreading that public
The
health
data,
message.
yeah, I already know the data, but I believe that you're at a higher risk of dying from gun violence in Baltimore City as a Black man than you might be from COVID, right?
Right, right.
The gun violence or the violence epidemic has been around forever.
Yep.
Continue to address it is most important. We can't forget it. We cannot leave it by the wayside. People in these communities often feel less than because everything and so much is often stripped from them.
Yep.
They don't have the access and they don't know where to go find information. They carry on life normally when things are so abnormal right now.
Yep.
It's extremely important for us to be out there. It's extremely important for us to continue to outreach, not only through informing them about COVID, but the outreach work that we're doing around safety, around their safety, around the safety of their families, their friends, their community.
Yep.
It's really important for us to stay out there and continue this work.
I agree. Yeah, no, thank you. I appreciate that. And that was great. Really, I think that was important to set the stage for the kind of practices that we're talking about tonight. As JT said, you know, ROCA implements cognitive behavioral therapy, and it's funded, you know, ROCA programs like it could be funded by the Maryland VIP program if VIP was adequately funded by the governor through his budget. So now we're going to go from the sort of the street level and where the rubber meets the road and what is actually happening to sort of a 10,000-foot look from Mike McLively, who is the senior staff attorney at Giffords Law Center. He is the director of the organization's Community Violence Initiative, an effort to use policy mechanisms to support and promote evidence-based violence intervention strategies in America's most impacted communities. He's the author of 3 major reports on the topic of community violence, including A Case Study in Hope, Lessons from Oakland's Remarkable Reduction in Gun Violence. So Mike, thank you so much for joining us from across the country. We're delighted to have you tonight and look forward to hearing from you.
Thanks so much for having me. Good evening, everybody. Thank you for taking the time to join us for this really important conversation with so much that's going on right now. It's really great that you're taking the time to be here, so thank you. I'm going to keep my comments really brief, and like Delegate Lierman was saying, really just focus on the national picture and give you a sense of what we're seeing around the country and some trends that we're seeing at the state level, and then talk just briefly about how Maryland fits into that picture. So really quickly, Giffords, as Delegate Lierman was saying, we're a national organization named for Gabby Giffords, who's, I think many people are familiar with her, but if you're not, she's the former congresswoman from Arizona who was shot in the head in a mass shooting back in 2011 that a lot of people will remember. She fortunately survived that and formed the organization that eventually became Giffords. We have an office in San Francisco where I work, so I'm based in California, and like Delegate Lierman was saying, direct our community violence work. So Giffords as an organization is focused, our mission obviously is to end gun violence in America. You know, we have, compared to the rest of the developed world, some of the worst levels and rates of gun violence, and we think it's entirely preventable. And our mission is to really work in all 50 states with legislators, with activists, with advocates to talk about different tools for reducing gun violence and help raise awareness for the issue. So a lot of our work is around regulating access to guns and putting in place smart gun laws. So we're talking about universal background checks, limiting access to assault weapons, large capacity ammunition magazines, a host of other strategies to help keep firearms out of the wrong hands. And then the community violence work is in recognition of the fact that we have to pair those laws and those strategies with community-centered, evidence-based approaches, and the type of work JT was just talking about, where what we see in city after city is a very, very small percentage of a given city that is driving the vast majority of violence. And we have tools and ways to identify who those individuals are, and if we can intervene with them in an effective way. And like JT was saying, this isn't just like a 1 or 2 time thing. This is a long-term intensive intervention process. But when we can do that, we can see enormous reductions in violence in a very rapid way. And so I think what gets lost sometimes in the conversation is that there are more gun suicides than gun homicides, about 20,000 to 10,000. So many, many lives are lost every year in this country. But in that conversation of homicide versus suicide, I think some people think, well, suicide is the bulk of this problem. That's where we should be focused. And obviously we need to address both. But what doesn't get talked about as much is there are tens of thousands of non-fatal shootings that are happening in our communities. So when you add those together, the homicides and non-fatal shootings, that's actually the single largest driver of gun violence in our country. And looking across the nation, that's happening disproportionately in underserved communities of color. And the good news is there are really a number of amazing evidence-based strategies that are out there that work very quickly and that they require an investment and a sustained one, but not an enormous investment, especially compared to the huge cost of gun violence when it comes to lives lost and forever changed, the cost of healthcare, law enforcement, all these things are extremely costly. And just to give you a quick example, in the city of Oakland, where I live, we've seen a 50% reduction in homicides and shootings in the last 6 years or so. And that's come from implementing programs like JT's, similar methods that are being coordinated by a city agency that's dedicated to violence reduction. They're bringing together local resources from a parcel tax that was passed by voters. That's a 10-year-long initiative, so long-term funding. And that's been paired with an investment that California has made called CalVIP, which is exactly like Maryland VIP, and that was actually based partially on what we've done in California. So blending together that local and state funding and also using creatively some federal funding streams that are out there. And so I think, just to wrap this up, what we're seeing right now is even during this pandemic and while people are sheltering in place, a huge amount of violence is continuing. And like JT was saying, this is an ongoing problem, and sheltering in place has not caused a reduction in community violence in most communities. We're actually seeing in many places an increase in that violence. And so while a lot of different types of crime are on the decline because of shelter in place, community violence, domestic violence have not responded in the same way. So that link, the communities that are most vulnerable to community violence are the same communities that are most vulnerable to this pandemic and to COVID-19. And it's incredibly important that our policymakers around the country understand that link and realize that we need our violence intervention workers and that frontline community to be getting messages of public health and public safety out to vulnerable communities while they're also continuing their mission to reduce violence. So there's only a few states around the country that have actually invested significant dollars in promoting those types of community responses. Those that have, like New York, Illinois, Connecticut, Massachusetts, Maryland for a bit, as you mentioned, Delegate Lierman, but those that have seen remarkable reductions in community violence. And so we think that state investment is an important part of the picture. Obviously, with the economic situation that we're in, it will be harder than ever to make this argument that, you know, we need to be investing these funds. But frankly, there's such a connection between the current crisis and community violence that we just can't afford to not act. So we're going to continue making that case with a lot of the partners that are on this webinar and working around the country at the local level, at the state level. And then the very last point I'll make is that there's a lot of federal resources out there, obviously, to respond to coronavirus. And because of this strong link, we think there are some ways to leverage some of that emergency federal funding to help support a lot of our community groups that are doing this work. So at Giffords, we're exploring ways to leverage that. We're continuing to push state legislators to make this investment, to keep it up. And I think the good news is that states like California just announced they're going to be continuing their investment in CalVIP. Virginia, for the very first time, passed a program very similar to Maryland VIP, to CalVIP. So they're continuing to invest despite this difficult economic environment. New Jersey just last year, $20 million to scale up hospital-based violence intervention programs. So we're seeing a lot of positive momentum, and we're going to do everything we can to keep that going. And I think you're going to hear more from the other speakers about the specific work in Maryland. But the great development is that there's a whole coalition now of folks who do both the frontline work, like JT was talking about, and who are advocates and in the gun violence prevention space, who are coming together to create a very powerful voice to raise this up and make sure that it continues to be an issue that's addressed in Maryland. So thanks so much for the opportunity to speak.
Yeah, no, that was great. Thank you. I think the national perspective is really helpful. I think sometimes we have a tendency to think that we are the only ones going through this, but we know that this, gun violence that we are experiencing in Baltimore is happening in other places too. And so we need to learn from what has gone right in places like Oakland and elsewhere throughout, the past 20 years that some of these practices have been implemented. So thank you, that was great. Now I'm happy to turn it over to one of our local policy person, Daniel Webster. He is the inaugural Bloomberg Professor of American Health at the Johns Hopkins Bloomberg School of Public Health, where he directs the Center for Gun Policy and Research and serves as co-lead of the Violence Prevention Work Group of the Bloomberg American Health Initiative. Dr. Webster is one of the nation's leading experts on the prevention of gun violence and has published over 120 articles in scientific journals on topics including gun violence, violence prevention, youth violence, intimate partner violence, suicide, and substance abuse. Uplifting topics. A lot of articles. Thank you for being here. Thank you for all your work, Dr. Webster, and I'm delighted to have you here tonight to talk a little bit about your work and the broader research around violence prevention and intervention programs and their successes. Thank you.
Sure. It's really an honor to be part of this panel, Delegate Lierman. Thank you for inviting me and for putting this together. I've been studying gun violence for almost 30 years now from a public health perspective. I know that for many people, particularly if you're thinking about Baltimore, it can seem as though nothing can change. It seems the rate at which we see shootings and murders can seem as though this is a hopeless kind of thing that we are facing. But through research, we've found that there are programs, there are policies that do indeed translate into fewer people getting shot, fewer deaths, less trauma of the type that JT so well described in the young men that Roca engages with. We all need, some people in public health will sort of put forward a stance that we don't need law enforcement, we got this as a public health problem. My view is, well, yeah, of course we need law enforcement, but law enforcement will tell you they need public health interventions to address this problem. They understand the kind of issues that the young men are facing who are at high risk for gun violence, and that they cannot arrest their way out of this or just put everybody in prison. So we have to invest in people. We have to invest in the places that are most impacted by this problem, that also, of course, coincides with the hotspots for the coronavirus as well. I should note that there are important similarities in thinking about a problem like gun violence and an infectious disease pandemic that we're facing right now. Gun violence does operate to some degree as a social contagion. It goes through social networks, high-risk behaviors, and in many things that we study in gun violence, a lot of that risk-taking behavior is driven by desperation, frankly. We know that in so many aspects of the things that we grapple with in public health. And so it's important to understand these underlying, what we refer to as social determinants of health. And we have to address those. We do have effective interventions, and we have some pretty good sense of the combination of things that are needed to lower rates of gun violence. We need, first of all, you need to connect with the right people. And that takes special people. JT knows that work and understands that. You have to invest in those people to build those trusting relationships, as he so well explained. That is really the key. They are in the Safe Streets program in Baltimore, which I've studied for over a decade. We've seen a direct correlation between conflict mediations, changes in attitudes about how you respond to conflict, and fewer shootings. And I'm glad Mike McLively also noted the Oakland success story. That is what Maryland should be thinking about, is the Oakland model, because they invested in one of the biggest public health problems that was plaguing their city. And they invested in it, and now they're seeing 50% fewer murders. They are doing it with evidence-based strategies, but it's hard work. It requires investment, but it's paying off. And the last thing I'll say, just is, look, I'm a researcher. I think research is important, of course. This is hard work to do. We need to study the interventions. So we're going to keep learning. We're going to try to continue to innovate and get better. So I think that's part of the investment as well. We have to continue to learn about how we do this best, and we are learning. And there's a direct correlation: more resources, more impact.
Yep. Thank you. Yes. Thank you for explaining that. And one thing that's important to note is in the bill that Senator Jill Carter and I worked on this year that the House and Senate passed, but that the governor vetoed, we in fact had additional resources and additional language requiring more research into the programs that Maryland VIP would fund for exactly that reason, right? We haven't figured everything out. We know these programs that work, but they can constantly be improving, and they improve when we study them and figure out
Exactly
why something worked or didn't, and then expand on that. So thank you for raising that up. And now I'm delighted to welcome Greg Jackson. Greg is, let's see, he is a community organizer, a communications specialist, and campaign strategist and experienced issue advocate in Washington, D.C. Greg currently leads CJAF's national advocacy efforts. He comes from the Washington, D.C. Office of Neighborhood Safety and Engagement, and in this capacity, he oversees community events, outreach activities, policy development, and violence reduction programs, and direct engagement of residents most at risk to gun violence in Washington, D.C. My hometown, actually. I grew up in Northwest Washington until we moved to Maryland in middle school. So delighted to have Greg on this evening, and I'm going to turn it over to you, Greg. Thanks.
Awesome. Thanks again for having us. And believe it or not, I'm tuning in from Clinton, Maryland, and my girlfriend.
Oh, nice.
So who knows?
Nice.
Maybe you might have left. I might have left. So we'll see how it goes. But thanks for having me. And thanks for the introduction. I'm Greg Jackson with Community Justice Action Fund. And I come from this work from a very personal space. Just wanted to share that, in 2013, I was shot late night, frankly, from someone who misidentified me as someone else. And, took lethal action to try to end my life. And unlike the movies, that incident wasn't something you just jump up and brush off. I was in the hospital for 21 days and recovery for 6 months. And during that time, there was two things that were very pressing. One was that we weren't seeing, this was in 2013, we weren't seeing a lot of national advocacy or efforts around gun violence. If anything, elected officials were avoiding the topic. And then secondly, I'll never forget, my nurse shared that, every day, young Black men like me come to that hospital and have to go back into communities and neighborhoods that are rough and unfortunately unsafe and dangerous to them every day. And they don't have any real support. And so I came out of that experience. I did a lot of organizing and campaign work before, but really just head focused and committed on advocating around gun violence prevention and figuring out what we could do to help turn this around. What's been exciting is that we have seen a lot of progress in states like Maryland and Oakland and California, thanks to some of the amazing work with Mike Lively and others. States are really starting to step up and invest in these efforts. Additionally, I really want to flag, we're seeing a lot of cities starting to step up too. Charlotte now, North Carolina is about to open their first Office of Violence Prevention. We just saw Chicago. The mayor passed $7.5 million in emergency funding to keep a lot of the programs like Safe Streets and ROCA afloat in Chicago. And I know we already spoke to kind of California, what's happening there, but even Virginia this week decided to protect their $2.6 million in funding for their violence intervention and prevention programs. Unfortunately, in Maryland, that was vetoed, and that is a really, really scary thing that we all should be rallying around. But we are seeing progress. I think the other thing that's amazing is that due to a lot of hard advocacy efforts, especially for folks on the ground and on this call now, we're also starting to see a lot of the local momentum bubble up at a national level. So the advocacy for funding is now moving. We saw even in this presidential race, Senator Elizabeth Warren pledged to fund $100 million annually for programs like this. Yep. Vice President Joe Biden has already committed in his gun safety plan to fund $900 million in 8 years. And then we saw a couple really amazing efforts in Congress. Senator Booker and Representative Horsford brought forward what's called the Break the Cycle Act, which was focused on funding these type of programs, $90 million over 10 years. And then most recently, I'm really excited to kind of leak this to you guys, but Senator Duckworth and Senator Booker and 9 other senators have signed on a letter to fund some emergency funding of $250 million to go to violence intervention and prevention programs nationwide. So it's just a letter, and it's a lot of strong voices.
That's good.
Yeah, but they're getting it, you know, and I was really blessed to be a part of those conversations and kind of helping them understand how important this is, but also how to structure the funding in a way that it gets directly to programs like ROCA and JT, and it doesn't get lost in some big, you know, police department budget or public safety initiative. So lastly, I just wanted to share with you all, there is movement happening. A lot of the advocacy is happening and working. And I wanted to give a big shout out to Liz and JT and Karen. Here in Maryland, there's a really amazing coalition, which I'm sure we'll hear more about, that have been working together to fight at the state level. But their work in progress has really been an example alongside California in how we should do this in other states. And a lot of other states are starting to come together and push in a very similar way. As far as CJAF, just a couple things that we've been able to do. We did a big partnership with March for Our Lives and launched what was called the Peace is Essential campaign. And that focus is really to put pressure on governors across the country to make sure they know that the community and residents know that peace and gun violence prevention programs and hard workers like JT are essential employees in this crisis, and the funding for them is as essential as a fire department, a police officer, and our frontline health workers. And we've seen some really great progress and great responses from that. Last thing I'll share is that we started to build a coalition called Policymakers for Peace, which is a lot of amazing policymakers like yourself, Delegate Lierman, who are really passionate and being leaders on this effort, but just bringing them together to share some innovative approaches. Our chair, for example, in St. Louis, she's the treasurer of St. Louis, and she was able to reroute some of the funding from parking tickets to start college funds for folks who are in neighborhoods historically impacted by gun violence, funded by the city. So just thinking about creative approaches from the position of a policymaker or elected official, they're starting to come together and brainstorm and really work together across the nation. So we are excited to share that, excited to be a part of this, very excited to be behind you, Delegate Lierman, and all the amazing organizers and activists, and most importantly, our frontline workers like JT out there. So thank you again for having us.
Thank you, Greg. Tashara Jones is your chair. I didn't know that. That right?
Yeah,
great.
she's
Yeah, I
on
know
fire.
Tashara. She's awesome. She does great stuff. Okay, that's great. Yeah. Thank you for joining us. Thanks for explaining some of what you are doing around the country. It's really important, and thanks for raising your voice. But I want to clarify, I'm behind you guys. You're not behind me. I want to support all the great work and great organizing that I see you all doing. I'm thrilled. It's so important to help actually move the pieces, move the policy forward. So thank you. Now we are going to end our speaking program with Karen Herron. And then we're going to move on to some Q&A. So if you have some questions that you didn't submit or that you submitted that haven't been answered yet, feel free to put them in the chat box so we can make sure that we get to them. Karen is the legislative director for Marylanders to Prevent Gun Violence. She practiced law in California and DC with experience in criminal prosecution and defense, commercial litigation, and agency law. And she's been an advocate on gun violence prevention related issues for about 7 years in various capacities. And she joined Marylanders to Prevent Gun Violence team in 2019, stepping into the legislative director role in 2020. We're great to have you here, Karen. Thanks so much for all your work. Marylanders Prevent Gun Violence, Liz and Jennifer and everybody who's been doing great and important work at the state level. So happy to have you here tonight to say some words. Thanks.
Thank you so much, Delegate Lierman, for your important work on Maryland violence intervention and prevention legislation. This webinar, I think I'm muted. Can you guys hear me? Okay. I just want to put a shout out to you because your staff did you and your staff did an absolutely amazing job getting together so many different gun violence prevention advocates from such a wide range of angles to testify on your bill this year. And it really was the impetus for us all starting to have conversations among ourselves about what we could do to further educate the public and legislators, and I'll talk a little bit more about this as I wrap up. But that really helped connect us in a way that I think has been very helpful in light of this pandemic. For so many of us who live and work in this zone of gun violence prevention, these efforts to reduce violence by addressing those who are most at risk at becoming victims and or perpetrators, it seems so obvious. But questions from legislators in Annapolis this year, and especially in the state Senate, highlighted the need to really educate the public and legislators on the goals and the successes that this work brings to Maryland. From the Safe Streets workers who literally stand between shooters de-escalating real-time violence, to the ROCA workers who take young men who have had everything stacked against them and teach them how to function in a non-violent and productive way, to the trauma care hospital workers who are on the front line after a shooting and who are in the best place to initiate wraparound care, therapy, and resources that are needed to not only recover from the gunshot wounds, but to move on and away from the lifestyle that led that individual to that place. These and other amazing organizations in our Violence Prevention Coalition are just absolutely critical in this fight. In highlighting the work that's going on in Maryland to reduce gun violence, or to reduce violence, really, we must also recognize those organizations that are addressing individuals that are at risk of becoming the future victims and perpetrators of violence, as well as those that are in the throes of it now. Programs like Marylanders to Prevent Gun Violence's Liberty Elementary School trauma counseling program for young children who have experienced significant trauma, inducing losses in their young lives, and organizations that specialize in domestic violence intervention and protection programs, programs like ROAR, who seek to assist victims of all types of crimes. They all have a part to play in the long-term success of any violence reduction strategies. We had great hope that the importance of all of this work was starting to be seen for the value that it is with the passage of Maryland VIP this year. Defunding or underfunding all of these important elements just shouldn't be an option. We are extremely disappointed that we were unable to help the governor to understand this issue, and that he instead chose to veto the baseline funding that it was to provide. We do know that gun violence is not a simple issue. We need legislation, but we can't simply legislate our way out of this. We need to legislate with a true understanding of the problems and of all of the intricate violence reducing components that are already out there, and that which need to be sustained and grown. It is critical that we fund violence interrupters. We have to be willing to be able to recognize that everything from gun access to a lack of opportunity, to a failure to address childhood trauma, even to our history of how Black and Brown people have been treated in this country, needs to be addressed and considered as we work towards solutions. Thanks again to Delegate Lierman and everyone who took time out of their busy schedules to contribute to this tonight and to tune in to this very important topic. We definitely need to continue the conversation.
Thank you. Thanks so much for rounding us out, Karen. Appreciate it. I do also want to give a shout out. I believe Charlotte Crutchfield, Delegate Charlotte Crutchfield from Montgomery County is watching tonight, as well as Delegate Maggie McIntosh. So thank you. And thank you for the shout out to my awesome legislative director, Karen, Danny DePietro, to put these together and did a great job at pulling it together, all of the testimony this year. So thanks, Danny. So let's jump into some of the questions. We've got some going in the chat, and then a lot of people submitted questions when they RSVP'd, so thank you for that. I'm going to start with just a couple general questions, and feel free to just unmute yourself and jump in if you have an answer. Of course, we only need one or two folks to answer each question, but I'm not going to not let you answer if you really have something you need to say, but I want to get through some of them. So Let's see, there was a question about high contact programs like Safe Streets have shown so much progress. How can that relationship-based response and peace building work continue in these times? There were a few questions about how can the work that Safe Streets is doing, which is so hands-on, continue during a time, you know, I think Roka's like this too. How can that sort of work continue during at a time when we're not supposed to be hands-on? JT, I don't know if you want to start talking a little bit. You addressed that a little bit about what's going on. I'll say, you know, from my the Safe Streets programs in my district, they're sending me pictures all the time of the food drives they're doing and the masks they're giving out to residents and the grocery boxes they're bringing to neighborhoods and the census materials they're taking with them and the hand sanitizer they're giving out. So, you know, certainly they're still out and doing important work. JT, do you want to add anything about the work, how Roka's work has continued during this time?
Yeah, I'll add something. So the way that for us to be allowed to do the work on the ground is for other people to do that type of stuff. Other people should be stepping in, handing out the hand sanitizer, handing out the food, because we still have to work on the violence.
Right.
If we have to be everything to all people, then it takes away from the real focus. So, I mean, while we do educate our young people on what's happening and how it affects their families, we have to stay laser focused on what the real issues are, what the real problems in the community are. And the real problems are the violence and the things that they see when they walk out their front doors. Social service, they can handle the hunger. You know, in a time where it's limited access to food, well, let's try to help them find resources with other resources that could connect. We have to be very focused on what our purpose is. And our purpose is to service our young men or the people in our communities in a way in which will help effectively change their lives and help keep them safe. Now, of course, if they come to us and say they're out of food, they're out of this, that, and the third, yes, we will make an effort to provide it. But again, we have to change their thinking around everything, because that's just like putting a Band-Aid on the surface. And that's happening too often. We got to stop putting Band-Aids on, and we got to really start healing some wounds. So I think for us, we've been out there. We haven't stopped doing outreach since day one. Since the pandemic, we have not stopped. We have been out there. We have been doing outreach. We have been knocking on doors. We have been equipping our staff with the proper PPE. We've been practicing social distancing. We have had to modify and go through weeks of struggling to change different policies and procedures so that we could continue to operate safely and effectively. And the biggest thing is that, you know, our building is shut down right now, so young people can't come into the safe haven that we provide them with the building. So we have to really be out there and really stay on top and really be engaged. This is the time where we almost have to do more than what we've done before, because now they're feeling isolated. They're feeling even more alone now, because again, if we remove the trusted relationships that we have from them, for some of them, we're all they have.
Right.
We have to continue to engage them and figure out ways to do it safely. So we've been really working hard at putting in new policies and procedures to continue to be able to continue the outreach work.
Thanks for that. There are a few questions about sort of the research and how many guns come into Baltimore City and to Maryland from outside Maryland. What does, you know, and then there's a specific question about the status of the report regarding Baltimore and gun violence from the Center for Gun Policy and Research, and the status of, you know, funding these efforts, which we talked about a little already. But Dr. Webster, do you want to talk a little bit about where the guns are coming from that are used in Baltimore? And we've passed some legislative fixes for that, as you know, and you've been instrumental in, but do you want to talk a little bit about where some of these guns are coming from?
Sure. Thank you for that question. It is something I've been tracking, frankly, my whole career. But when Maryland really significantly strengthened its laws in 2013 with the Firearm Safety Act, what we saw two things. One was the guns that moved very quickly after a retail sale into criminal involvement. Those that were being sold in Maryland, we saw a 75% decline in that metric. That's a metric I pay very close attention to. So that was a very positive thing in the months and years immediately after that law went into place. The other thing that we saw was the shift in the percent of guns that were Maryland guns versus out of state. It used to be that 55 to 60% of our guns were Maryland guns that were used in Baltimore. Now, the majority are coming from out of state. Many of them are coming from Virginia in particular, West Virginia and Pennsylvania. So patterns have shifted. I think a new thing that I actually am very concerned about is the emergence of so-called ghost guns. These are guns you can make from kits with a little bit of technical savvy and some tools. And I'm concerned about that. And I think it's something that Maryland legislators are going to have to get in front of because those guns are on our streets and more of them will come on our streets if we don't address them. Very briefly alluded to a report. We will be having a report that will come out in the next week or so that will focus on gun law enforcement issues and strategies that we think will make that enforcement both more effective, focused, and fair, basically, with strong systems of accountability that I think are really critical to regain our trust in that whole endeavor.
Thank you. There are a couple of questions where folks ask for your advice. So what advice would you give to Commissioner Harrison to ensure that BPD is working with these types of programs, effectively incorporating diversion to avoid creating more black men with records that see the streets as their only possibility to support their families? And then a concurrent question is, what advice would you give to the mayor's office to more effectively incorporate these types of practices? And I think any of you can answer because you're all doing this work. Mike, you might have ideas from other cities of how Oakland or others did it, Dr. Webster or JT. You might have a perspective on here, what you're seeing. And Greg and Karen, if you've seen things elsewhere as well that you want to bring in. A couple questions, you don't all need to answer, but if anybody has thoughts on what could BPD or the city be doing to more effectively bring some of this in?
Yeah, so I'll mention a few things that will also be illuminated more in the report that we'll be issuing. But a strategy that's had the most consistent effectiveness across cities is something called group violence intervention. And it is highly focused on the people with greatest risk. You bring forward the capacity from a law enforcement perspective to respond if anyone is going to resort to gun violence. But really the whole point and goal and orientation is to stop that, and prevent that, and to provide resources of the type that ROCA and other service providers can provide to get these young men on the right track and in a safer lifestyle. Another component of that is the community voice in that the voice is there in a supportive way that says, we need you to be part of positive parts of your community. It is a cornerstone of Oakland's success that we talked about earlier. So, and actually the commissioner knows very well that this is what he would like to do as well. In our report, very briefly, we also recognize that there are a lot of arrests with people with guns. And, in some cases, yeah, someone might have to do a little time in prison. But what we underscore is that these are young men with really a lot of risk. They need help, and we're not providing it. ROCA is doing some of that, but the capacity is not there. We need more capacity. A young man who gets caught with a gun is probably a desperate person who needs help, and we're not providing that. And so all effective strategies that I've seen have this right balance of there's a capacity on law enforcement to do what it has to do if someone's taking a life, but there's this other capacity that's going to support people to keep them safe and on the right path.
Yeah, I have something to add to that as well. One of the pillars of our motto is engage institutions, and one of those engaged institutions is working with the police, actually.
Mm-hmm.
And as a community, what we have to realize is a couple of different things. You have a lot of police officers, or a lot of police officers in Baltimore City specifically, that are as traumatized as people in the community. And part of our engaged institution work is to help bridge that gap, to really rely on them as a really solid partner, because they have a lot of interaction with these young people.
Mm-hmm.
And gain their trust and gain their respect to be able to work with us, to help us work with these young people as opposed to locking them up. Then we'll get a lot further. So a lot of the work that we do, one of our best partners is actually BPD, because of the fact that there are a handful of officers within BPD that we really can trust, that we really have good, solid working relationships with, that when they see my young man on the street doing something that he's not supposed to do, as opposed to locking him up, they'll give me a call first. Say, hey, JT, I saw your guy out here. What's up with that? All right, let's on it. And allow me the opportunity to address the situation first before they throw handcuffs on. Number one. Number two is you do have officers that really care about the community and some that really want to see change. So those officers proactively will say, hey, I know a program that you should be a part of, this ROCA program, and they'll make referrals themselves. So I get calls from officers sometimes at all times of the night, saying, hey, look, I got a kid for you. And all I ask is that you give us a real opportunity to work with them and understand that you might not like everything, but we will try to address them as much of it as possible. So, BPD has been a pretty solid partner working with us from the very beginning.
That's good. That's good to hear.
Mind if I jump in on this?
Yeah, go ahead.
So one big thing that we are always reminding folks is that law enforcement is by definition a reactive approach to gun violence.
Right.
So you're enforcing a law after it was broken.
Right.
And so to ask a reactionary system to take a proactive approach is already like, sticking a square into a circle.
Right.
So from our perspective, we really have to focus on what are the root causes that are leading people to committing a violent offense. When I worked for the Office of Neighborhood Safety, we had a program very similar to JT's in ROCA, where it was a voluntary program of people who had previous violent offenses on their records. And these people were not monsters. These were leaders, these were comedians, these were entrepreneurs, these were fathers, these were mothers. And with the right investment, we saw really great results. 98% of them came out of that program with a full-time employment, no future criminal activity, and really charting a whole new path. And that just took a very focused investment. And if we can actually duplicate that when people are younger, like what ROCA's doing, providing that wraparound support to people before they have a violent offense on their record, is one way to get to the root causes. We also have to look at, frankly, what is the education system doing? What are the housing conditions? What is the concentration of poverty? And really look at the entire ecology that is feeding this. Unfortunately, someone who commits acts of gun violence, if you look at the profiles, it's a very predictable list of things that have happened before they got to that point. And if we can see that, then government or the community should be able to step in a lot earlier in the process and hopefully help people, lead a different path. And I don't think it's fair for us to look at police departments to do that. Now, of course, they're going to do their best because they care, but we have to get more upstream and catch a lot of these things before it happens. And that is a way more expensive, comprehensive public health approach. But that's what it's really going to take to end this crisis. We can't lean on the police department to enforce their way out of this. A lot of cities are trying it because it's cheaper and it's a natural fit because of the culture of America, but it's not working anywhere. And so we really have to get upstream.
I appreciate that. And yeah, go ahead.
I just wanted to say that these are all great points. And just really quickly, another thing that gets missed in this conversation when it comes to police departments is the role of actually solving homicides. And the homicide solve rate in many of our cities, Baltimore included, is incredibly low, and it disproportionately is low in communities of color. And so when you're solving 10% or under 20% of homicides that are happening in your city, you can imagine the effect of that. And so one of the things that Oakland did in its success was really focus on, at a police department level, focusing on increasing that homicide solve rate. And in just a number of years, they really increased it from somewhere in the 20s up to close to 70%. And a lot of that was focusing on building back what had been lost and broken community trust. So there's this huge relationship between that homicide solve rate and the amount of trust that a police department has with the community. And so for leadership, whether it's the mayor or the chief, it has to be one of the highest priorities to regain that trust of the community and make that an actual resource commitment, not just a talking point, and to make sure that leadership across the board is prioritizing building that trust, improving the homicide solve rate, and focusing much less on this broad, casting a wide net to arrest as many people as possible and using that as a metric of success. We should be focused much more on actually solving the most serious crimes that are impacting our communities.
Yeah. That is a great point, and I'm really glad you brought it up. We could do a whole webinar on unsolved crimes and the problems and why are crimes not, why are homicides not being solved, what neighborhoods they're not being solved. And there's been some excellent reporting, and I think it was in the Trace and others, about this issue, because it is a real issue. And in our communities, why would you, it's sort of like, why would you talk to a police officer if you don't think they're going to solve the crime? Like, you're putting yourself at risk, right? So it's a real issue that we have to think about. I do want to sort of raise up our commissioner. He sent his top person to come down and testify in support of the Maryland VIP bill, and he has spoken out repeatedly in favor of, because he understands, exactly what Greg said, right? That his department is one piece, right? This has to be a braided effort, and his department is one piece of solving the violence challenges that our system is facing and that our city is facing. But this, public health oriented, the violence prevention has to be a really big piece as well. So, there were a few questions, and I saw a comment about what's the role of community? How can the public, how can community residents support programs like this? And how can we support the healthcare approach to gun violence? So we're going to take some comments on that, and then we're going to get back to the actual legislation, because there's been some questions about the legislation, and then we'll wrap it up. So what's the role of community and the public in supporting these kinds of programs?
Get in the governor's ear.
Yeah, there's that, yeah. Other thoughts on the role of community in the healthcare approach to gun violence, or the role of the public in supporting these kinds of programs?
I wanted to say just two quick things.
Greg, yeah.
Another big thing we saw when we work with folks who have committed an act of gun violence is almost all of them were survivors of gun violence first. And so there's a big opportunity there for communities to support survivors and make sure they get, whether it's resources, whether it's just having a warm hug, knowing someone has their corner, helping them find a new job, or, there's a ton you can do for survivors of gun violence. I think that's huge. And then on Daniel's point, being an activist goes a long way. We saw a lot of great progress because of some of the amazing advocacy we did behind Delegate Lierman's bill. And that is huge. And if we could fill that room with 4 times that amount of people, that will go along that way. And you can also advocate with your dollars. Like, if each of us had gave $50 to Roca, imagine how much more they could do with that extra $1,000. And I know we can all do more than that, but I would say those 3 things: support those that are hurting the most, advocate and be an activist, and then donate. Use your dollars. We have it. We can use it.
Right. I appreciate that. That's great. There was a question that I forgot that I think several people had as well, which is, how has the pandemic affected gun violence in the home, outside the home? A couple of you briefly touched on that. Would any of you like to comment a little bit more on how this pandemic, what's been happening in terms of gun violence during the pandemic?
I'll chime in a little bit on that. So it's honestly been mixed in different cities, and it's still early. What most of us anticipate, because what we understand about gun violence generally, the connection between availability of guns, high stress, despair, those sorts of things. We have great concern for domestic violence, for suicide, for underage youth having access to guns. They're in the home a lot now. They're bored. And there's been a big spike in gun purchases. So I'm concerned about all of those things. I'm also concerned, I think in the short term, some of the social distance measures may have curtailed some forms of gun violence, but further down the path with the economic devastation that's coming in the wake here, that's already here, I'm deeply, deeply concerned because I know, frankly, I've learned from Safe Streets workers, from JT, from others, that so much of the, people who are picking up guns are desperate, and there's going to be more desperate people.
Yeah.
So those are great concerns, and we have to address it. We have to address these issues.
Yep.
Can I add to that a little bit too? I think one of the things that we have to think about as we move forward is what happens when people aren't allowed to go outside or things happen. The domestic violence is one of those hidden things that happen behind closed doors, right? So people are limited outside, kids are inside, domestic violence goes up, child abuse goes up, all these different things go up behind closed doors.
Mm-hmm.
But what we have to remember is the people who are being abused, the victims, they have family that they're not having access to right now. If you beat my mom during COVID and I didn't get a chance to see the black eyes and the bruises, when I do see them when this is over, guess what? You got a problem on your hand. So now street violence starts to pick up as a result of things that happened during quarantine.
That's interesting.
You didn't have access to family. You didn't have access to friends. You didn't have access to all those people who would normally defend you when those things happen. So now, when quarantine is over, and now I get a look at these bruises, and I see all these things, you're going to see an uptick in some things happening on the streets. You're going to see an uptick in some problems in particular neighborhoods as a result of things that are happening behind closed doors during quarantine.
That's interesting. Thank you. I want to raise up that Mike put in the chat box that there's an entire section in one of the reports that Giffords did on the role of community in helping reduce gun violence in Oakland. So I'd encourage people to check out that link in the chat box and download the report. So I want to end, we don't want to go too much longer, but there were a couple questions in the pre-submitted questions and here about the bill specifically. It was SB 708 that was sponsored by Senator Jill Carter. I had the House version and we passed the Senate version, and that's the bill that Governor Hogan unfortunately vetoed. There was a question about why did he veto it. He vetoed all of our, unfortunately, he vetoed all of our gun violence prevention bills that we passed, including measures by Senator Hayes and Dahlia Tarr and others. Specifically in his veto letter, he said that because we did not pass his bill, he was vetoing all of our bills. So, I mean, I wish I was making that up. It's horrible. So we will certainly be pressing to override his veto. It's a priority of mine, and I encourage all of you to reach out to your legislators to make sure that they're on board with overriding that veto whenever the General Assembly meets next. So I want to leave it up to everybody to give us some final closing remarks just on, sort of what's next and how can we continue growing this, we've talked a little bit about what concerned citizens can do, how the community can play a role, but, leave us with some parting words. These are important practices. We do not need to condemn our communities and our city to live in a cycle of never-ending violence. We can move forward. So give us some final words and then we'll close up for the night. Thanks. Dr. Webster, you want to start?
Sure. The Oakland success story is really something everybody should take a look at. Oakland felt the same way that Baltimore feels right now. They came together as a community. They made reforms in policing. They invested in prevention, and they got to work. and their homicide rate is 50% lower. Baltimore can do the same.
Thank you. JT?
Change is possible. Change is definitely possible. And we have to continue down the path of change. We have to continue to invest in those things that will make the right changes in our young people. We have to continue to invest in our communities. But I'm hopeful. At the end of the day, I'm hopeful. Through all this hard work and through everything that's going on, I'm very hopeful that change is possible. We see it in the work with our young people every day. So change is definitely possible. We have to continue to work together. I appreciate you so much, Delegate Lierman, and all the work that you and Danny have been putting in, you know, bring us together and make sure that all these things are happening. It gives us hope that there is support, political support and down in Annapolis. And it helps us continue to push forward with the work that we have to do here. So again, I just thank you, and change is possible. We just have to keep pushing forward.
Thank you. Karen?
Thank you. Thanks again, Delegate Lierman, for hosting this tonight. And I guess I would just say that I'm so encouraged by the number of participants here tonight. And I know I recognize a lot of names, but there are plenty of people I don't. If you're interested in learning more or being connected with any of these organizations, feel free to reach out to MPGB. We are always looking for volunteers to help in advocacy work, in fundraising, you name it. We can find a place for you and connect you with whatever area you'd like to get involved in. So thanks again, and good night.
Thank you. Let's see, Mike?
Yeah, thanks so much, Delegate Lierman, for putting this on for everyone who attended and spoke. I think my message is the same as several others, which is just a message of hope. I mean, we know we can do better than we're doing right now. It's not like we need to discover what the strategies are or invent them. That, like, a lot of the hard work has been done. What we need to do now is get together and mobilize and advocate. And, you know, it's really encouraging, Delegate Lierman, to see leaders like you who see this intersection and understand that preventing gun violence is more than just changing our laws, and that good policy is also, you know, supporting our community organizations that are doing intervention work, building police community trust. There's all these other elements to it. So I'm really encouraged that you and other gun violence prevention groups are taking that up and building this relationship and coalition that we're seeing in Maryland. I think that is already a powerful voice and will just continue to grow. So I'm really excited to see that happening. And, you know, Giffords is just here to support those types of efforts in states around the country. So really grateful to many of you on this panel for the work you're doing, and we look forward to keeping this going. And thanks to everyone who took the time to be here.
Thank you. And Greg?
Yeah, definitely want to echo, thank you again, and thank you for just welcoming us as an organization to be a part of the fight. Again, this is very personal to me. I think it's personal, I'm sure, to a lot of us. But we do know there's real solutions. And if we really start to invest in life instead of just paying for death, we can really turn this around in a very big way. And there's a ton of examples that exist out there. But I'm inspired. I'm inspired by Safe Streets. I'm inspired by Delegate Lierman. I'm inspired by Karen and Mike and Daniel and Liz and the whole squad down there, Nick, Wilson, everybody. Matan, I could just shout him out for days. But most importantly, inspired by JT and the work that he's doing every day. And I just hope that, like, you know, 2 years, 5 years from now, there's like 50 JTs and there's, you know, a few of us celebrating, you know, and that we can definitely get there with the right hard work. So thank you guys so much for just being a part of this, learning more, and hopefully you'll join the fight.
Thank you. Thank everybody so much. Thank you all for your work, your continued work here. And thanks to everybody who's watching tonight, or if you're watching later on YouTube or Facebook Live. I always like to end these with a note of gratitude. Gratitude not just to the folks who are watching and our panelists, but also all our frontline workers. You know, we're in our homes right now because we can be, and that's a luxury. And there are a lot of people out there, from farm workers to Safe Street workers to ROCO workers to transit drivers to grocery store clerks, who can't be at home. And, you know, we're here because of them. And so a huge thank you to them, to you all for continuing this work. Now, I'm so inspired to know that there is a way out of this, that we can be saving lives. And I encourage everybody, as you continue to hear about our budget revenue declines and the fact that we have declining revenue in the states and that we have to make budget cuts, I just encourage you to remember that there is a cost to gun violence. There is a high cost to gun violence, to shootings and to homicides that are borne. That cost is borne not just by the families, which are these tragedies, but also by the states in terms of healthcare costs and lost potential and employment costs. And so, when we are investing these dollars, some of our scarce and limited dollars into gun violence prevention, we are saving money in addition to saving lives. And so we're going to hear a lot over the next couple years about how we need to cut budgets, but we have to make sure that we do it in a responsible way that isn't so that we're not, sorry to use the metaphor, shooting ourselves in the foot, right? Going forward. So we can't hamper our efforts to build a safe and just society going forward by trying to make easy cuts today. Thank you all so much for joining me tonight. Everybody keep in touch, stay safe, stay healthy, stay well. Take care.